All right, hello everyone. Can everyone hear me? Okay, so let's begin today. So today we're going to focus on skin diseases. We're going to go into our next major body system set of diseases, and kind of like what I did with the first section on respiratory diseases. I just want to give you kind of a brief overview of just the different types of normal flora organisms that we find on the skin, and just a really brief overview of the anatomical parts of the skin. So as far as the normal flora that we find on the skin, there are a lot of different types of bacteria that we can find here, and many of those different types though are Staphylococcus epidermidis. So in other words, if you were looking at all the different types of bacteria on the skin, the most prevalent bacteria that's on your skin is Staph epidermidis. But there are different species of Corynebacterium on your skin and Propionobacterium on the skin. Maybe not a lot, maybe not as much as Staph epidermidis, but definitely there. And some people, not all, but some people also carry this yeast on their skin called Malassezia furfur. And depending on where you live and what your age group is, sometimes this Malassezia furfur can cause a disease called tinea versicolor, where it feeds on the oils in the skin and cause, some discolored patches on the skin. But that it's only certain in certain age groups, and especially if those individuals they live in really warm, moist climates, it can be more of a problem. In others, it doesn't cause much. And some of this information that you see here, you probably might remember from your Anatomy and Physiology 1 lecture. And the skin is mainly made up of two layers. You have the epidermis, which is made up of a stratified squamous epithelium with keratin on top. And underneath that, you have a dermis, which is a lot of connective tissue. But within that connective tissue, there are very important structures like hair follicles and sebaceous glands and sweat glands. And one thing, your skin is the the primary organ that protects you from outside invaders invading your body. As long as your skin is intact, if you don't have any major cuts or burns or any sort of wounds in your skin, that stratified squamous epithelium and additionally the keratin on top really helps to protect you from being invaded by a lot of other organs. It's very difficult for bacteria and viruses and other things to actually penetrate the skin. But obviously, we're here to talk about diseases of the skin, and a lot of times when a disease of the skin occurs, it might be like a superficial fungal infection, or we'll talk about infections in like sebaceous glands where it's caused by a lot of bacteria because the sebaceous glands they produce a lot of oil, and a lot of bacteria like that oil. So some bacteria, if they can get an opportunity to infect that area, they will do so. Now, the other thing I want to do before I get into any specific diseases is to talk about some of the different types of lesions that we can see on the skin. So these are just manifestations where a certain skin disease will produce these different things on the skin. So we'll talk about vesicles, pustules, sellae, macules, and papules. So a vesicle is a circular fluid-filled lesion, and they're fairly small. They're usually less than a centimeter in diameter, and vesicles can be seen with certain diseases like chickenpox, certain types of, especially like the beginning stages of smallpox, which we don't see anymore, but it can happen. But they're just circular fluid-filled regions that are less than 1 centimeter in diameter. A pustule is a lesion that's not very circular, that has some irregular borders to it. But the reason it's called a pustule is because it's full of pus. And does anybody know out there what is pus? Yeah, it's a lot of dead bacteria with white blood cells. So That's exactly what it is. So, what you have there is you've got an infection with probably bacteria, and you have white blood cells that are going in there and killing those bacteria. So pus is really a bunch of like white blood cells and dead bacteria. So even though something like a pustule looks, kind of disgusting when you look at it, it's really the material that's in there is sterile. There's really nothing living anymore in there. A bulla. Well, I like to think of a bulla as a large blister on the skin, which with certain types of infections of the skin can happen. So it's greater than a centimeter in diameter and doesn't necessarily have to be round, but it's fairly large and it's fluid filled. Okay, but it's different from a vesicle because a vesicle is less than a centimeter. A bulla is greater than a centimeter and it's not really round. A macule is just kind of a flat rash on the skin. So you see this person has this rash all over the chest, but if you were to touch that area, it doesn't really have a lot of texture to it. It's fairly flat. If you compare that to a papule, on the other hand, a papule is not just a rash, but there's a lot of texture to it. I mean, if you were touching this area, you could definitely feel this. Okay, so the first few diseases that we're going to talk about are caused by Staphylococcus aureus. Now, the thing you have to understand is that there are many different strains of Staph aureus, and many of them, not all, okay, but many of them possess one or more of these virulence factors that you see here, and I want to discuss them a little bit. So there are some strains of Staph aureus that are considered to be coagulase positive Staph aureus. What that means is that they produce this enzyme called coagulase. And what coagulase can help this bacteria to do is to form a blood clot around them. And that blood clot that they form around them kind of serves as like a protective dome or a shield to prevent white blood cells from attacking them. Most strains of Staph aureus have a capsule, which also protects against phagocytosis. Many strains of Staph aureus produce this enzyme called hyaluronidase, which breaks down hyaluronic acid, and that can help the bacteria to spread through the tissues a lot quicker. And then some strains, okay, I'm going to star some strains, not all, of Staph aureus produce this toxin that's called exfoliatin. And strains that do produce this toxin called exfoliatin, they can cause this disease called scalded skin syndrome. And I'll talk about that in a minute. Now, typically when we talk about diseases caused by Staph aureus, we think of skin diseases, and that's exactly true. They do mostly cause diseases of the skin. However, later on when we talk about GI diseases, we're going to see that Staph aureus is it's one of the more common causes of food poisoning, because if certain types of food are contaminated with Staph aureus, this bacteria produces this toxin called an enterotoxin. And if ingested, it can trigger a lot of vomiting and diarrhea. It's not life-threatening. It's like, it might cause discomfort for, a day or so. But, because the person's vomiting and has a lot of diarrhea, you have to worry about dehydration. So rehydrating the person is a concern, but we'll come back to that when we get into GI diseases. Okay, well, let's go ahead and start off by talking about our first set of Staph aureus skin diseases. And the first three that I want to talk about here, I've actually listed them in order of severity. We have folliculitis, which is a pimple, furuncle, which is a boil, and a carbuncle. Okay, so what can happen is that a folliculitis can turn into a boil or furuncle, and then a furuncle can turn into a carbuncle if the infection keeps spreading and spreading and spreading. So a folliculitis or a pimple, if you've ever had pimples, which we all have had, what that basically is, it's an infection in a hair follicle. So remember that all hair follicles in your skin have these oil secreting glands called sebaceous glands. And if given an opportunity, Staph aureus can infect the oil made by the sebaceous glands. And when that happens, you have a folliculitis or a pimple. If it occurs on an eyelid, we call it a stye. Now, if a folliculitis or pimple infection starts to spread a little bit to surrounding connective tissues, and it gets larger, and as it gets larger, there's more swelling and pain receptors in the skin begin to be activated, then it's a little bit more painful. And this results in something that's called a furuncle, or more commonly known as a boil. And it's just basically, again, when a folliculitis or pimple starts to spread and gets a little bit larger. Okay, now let's say that somebody has on their skin a few folliculitis infections. So these little dots, let's say, are little pimples. And then if those are not treated properly and the infection spreads, then each folliculitis gets a little bit larger and becomes a furuncle or a boil. And if each one of those furuncles gets worse, they start to spread until they all kind of merge together and form a very large lesion called a carbuncle. So folliculitis can become a furuncle, and then several furuncles can coalesce together and form a carbuncle. Okay, so we're going from folliculitis to furuncle to carbuncle. So let me show you what each one of these looks like. So in this person's skin, right around here, in each one of these red areas around a hair follicle, this is a folliculitis. If it happens on an eyelash on an eyelid, we call it a stye. All right, now, as I said before, let's say that each one of these folliculitis infections gets a little bit worse, starts to spread to surrounding connective tissues. Well, then we get a larger lesion called a furuncle. And if a person has several of these furuncles on a part of the body, they can kind of merge together to form carbuncles, which you can clearly see ooze out a lot of pus. So this is a carbuncle is like it's like a really huge pimple. It's like a really, really massive pimple. Let's put it that way. Kind of the best way to describe it. Okay. Now, another disease that is caused by Staphylococcus is a disease that's referred to as impetigo. Now, this is a very, very contagious disease. It's very easily transmitted through skin-to-skin contact with somebody that has this. And, with the disease impetigo, one thing I'll talk about is that, 80% of all cases of impetigo are caused by Staph aureus, but another 20% is caused by Strep pyogenes. It looks the same, but it's just a different bacteria causing it. But both are very highly contagious diseases. And what happens here is that the part of the skin that's affected will have these patches that ooze out pus. And eventually what happens is that the pus kind of dries up and you get this sort of crusty, sort of dried up pus appearance to the skin. Okay. And that's typically what impetigo looks like. It's usually happens on the face, but it can happen in other parts of the body. Now, with a lot of these infections caused by Staph aureus, 30, 40, 50, 60 years ago, penicillin would have been the drug of choice to treat it. However, about 90% of all Staph aureus strains have developed resistance against it. So it's very unlikely that penicillin would work on a staph infection today. You have to choose some other antibiotics like cephalosporins, which are kind of broad spectrum. But remember, in the antibiotic section, we talk about how there are some fairly newer drugs that have been developed to fight resistant strains of Staph aureus, like vancomycin and methicillin. Those could be used if they're not resistant against those. Now, before we leave Staph aureus, there is another disease that I want to talk about that can be caused by some strains of Staph aureus, and that is this disease called scalded skin syndrome. Now, scalded skin syndrome is only caused by strains of Staph aureus that produce this exfoliating toxin. So no other strain of Staph aureus can cause this. Now, what this exfoliating toxin does, it attacks the desmosomes in your skin cells. Now, desmosomes are junctions that really tie cells in your body together. They really prevent two or more cells from separating from each other. But what this toxin does, it attacks the desmosomes in the skin, and it causes the cells to slough off, basically come apart. And a person that usually has scalded skin syndrome, it looks like they have a really, really bad sunburn. Okay, it's very contagious. It's spread through person to person, and it's usually treated with methicillin if they're not against it. And here is a picture of an infant that has scalded skin syndrome. In fact, while anybody can have scalded skin syndrome, we see more cases of scalded skin syndrome in infants or the very young. And the thing about this also is that this right here, this lesion in the skin, this is you can consider this to be an open wound in the skin. And just like any other open wound of the skin, this is susceptible to secondary infections. So if you're not careful, this area can be infected by other bacteria, and you would have a worsening situation. So that's why, with scalded skin syndrome, during the treatment phase, you have to keep the person isolated, and you have to keep this area clean to avoid secondary infections by other things. Okay, but with proper treatment and with proper care, the skin can be restored within a couple of weeks or so. So it's not like a permanent condition. Okay, so those were all of the things that I want to talk about as far as Staphylococcus aureus infections. So let's kind of move on to Streptococcus. Now, there are a lot of different types of Streptococcus bacteria, and sometimes it can be a little bit difficult to differentiate between, whether you have Streptococcus pyogenes or Streptococcus lactos or mutans or pneumonia. If I was in the lab, how would I differentiate between all these different Streptococcus organisms? Well, you would have to do what's called a blood hemolysis test. A blood hemolysis test looks to see whether or not Streptococcus bacteria can lyse red blood cells. If they cause complete lysis, we say that they are beta hemolytic. So this is complete lysis. If they cause no hemolysis, they are gamma hemolytic. And then you have some Streptococcus species that are alpha hemolytic, and alpha hemolysis is partial hemolysis. Some examples, the bacteria that we're going to spend most of our time talking about right now is Streptococcus pyogenes. Now, here's that bacteria again. We talked about it in the respiratory diseases section as the primary cause of strep throat, but it also led to other conditions in the brain and in the heart. But here we go again. It can cause infections in the skin. It's a very, very nasty bacteria. But Strep pyogenes is a beta hemolytic strep. It completely lyses red blood cells. Streptococcus mutans is gamma, and then Streptococcus pneumoniae is an alpha hemolytic strep. Okay, but again, we're going to focus mainly on S. pyogenes. So Streptococcus pyogenes can cause a variety of different types of skin infections, from impetigo, again, which is what we just talked about with Staph aureus, but about 20% of cases of impetigo are caused by strep. It can also lead to cellulitis and then possibly necrotizing fasciitis. And kind of the order that I've got these listed here is, a strep infection might start off as impetigo and then become cellulitis and then become this necrotizing fasciitis. Necrotizing fasciitis is that's the flesh-eating disease, or they might refer to it as the flesh-eating bacteria. And we've talked about the virulence factors before, but the reason that this is such a pathogenic bacteria is because it possesses many of these virulence factors. Okay, so impetigo, caused by Streptococcus pyogenes, looks exactly like the impetigo caused by Staph aureus. where you see a lot of these patches on the skin, especially around the face, that can ooze out a lot of pus. Now, sometimes what can happen is that this impetigo on the skin can spread to underlying connective tissues and even gain access to the lymphatic vessels in either the face or the limbs that are causing that where the infection is. And if that happens, this leads to a disease called erysipelas. So erysipelas is a strep infection in the skin that has really gained access to the lymphatic vessels. People that are more susceptible to acquiring erysipelas are the very elderly, also the very young, like infants, and the immunocompromised, so like AIDS patients or diabetic patients. Especially diabetic patients are more susceptible to this because they have poor circulation, especially in their limbs, and along with poor circulation, they have poor lymphatic drainage. And so if this bacteria is causing a lymphatic system infection, there's poor drainage there. And, erysipelas can occur in the face or on the arm or the leg. It can spread, to a lot of different places, but it's a very, very painful infection. Here's a person that has erysipelas in the leg. Now, if we get further, if the infection gets worse, all right, this erysipelas can spread to more connective tissues in the surrounding areas, a little bit deeper, and that could cause what's called cellulitis. Okay, so cellulitis is really a worsening erysipelas infection, and cellulitis is much, much more painful. It's very, very hot to the touch, and it's just, you have a lot of inflammation going on, or it's very red. And again, people that are more susceptible to developing this after a strep infection are very elderly, diabetic patients due to the poor circulation in their limbs, and the severely immunocompromised. Now, Streptococcus pyogenes is also one of the causes of this necrotizing fasciitis. In the media, they usually call necrotizing fasciitis the flesh-eating disease, and they call the bacteria that do this the flesh-eating bacteria. Now, Streptococcus pyogenes is one of the many types of bacteria that can cause this. And what can happen is, what you're seeing here, this could happen, let's say if a person has a cut on the skin and Streptococcus pyogenes invades the wound in the skin and can spread and cause widespread damage, or doesn't even have to be a wound in the skin. It could be a person that has strep throat, just a strep throat in their pharynx, and it spreads into the blood, and then the blood carries it to the skin, and this can cause this. Now, even though they call this the flesh-eating disease, and they call the bacteria the flesh-eating bacteria, well, it's not really like the bacteria are really, really like eating the flesh away. It's not exactly what's happening here. So the bacteria does make this toxin that does break down some of the tissue here, but also your immune system reacts against the toxin in kind of an exaggerated way, so much so that it initiates a lot of inflammation, which can cause this widespread damage. So a lot of the damage that you see here is really caused by the toxin made by the bacteria, combination of the toxin caused by the bacteria and your own immune system reacting against it. But, since it does look like the flesh is eating away, they conveniently call this the flesh-eating disease. Now, with cases that are very severe, like what you see here, a lot of times the limb would have to be amputated to save the patient and prevent the bacteria from spreading. But I want to share with you this story. Actually, I found this a few years ago, back in 2017, of this little girl. I think she was about 8 years old, or no, not 8 years old. Can't be 8 years old. She was like about 4 or 5. Anyway, so she had strep throat caused by this bacteria, and somehow the bacteria spread into the blood and got into her skin, and she ended up getting this necrotizing fasciitis, and she unfortunately lost her leg. She didn't die, but she lost her leg as a result of this. So it kind of goes back to what I was saying, is that it doesn't necessarily have to be a wound in the skin that's infected. It could just result from strep throat spreading into the skin. Okay. let's talk a little bit about Pseudomonas aeruginosa. Okay, so Pseudomonas aeruginosa is one of these bacteria that, if you remember from your list of bacteria, it is an opportunistic infection in certain patients, burn patients, but also people with cystic fibrosis, because people with cystic fibrosis, they produce a lot of mucus, and the bacteria loves mucus. As far as burn patients are concerned, this is the number one infection that they would have to worry about, because the bacteria is already in most hospitals. And so if there's a way to easily transmit the bacteria from staff to patient or between patients, this can cause a very serious infection in those burns. Another fact about this bacteria is that it produces this green pigment that's called piocyanin. And if a person that has a burn on their skin, if it's infected with Pseudomonas, one way you can tell is if the wound appears green, that might be an indication of a Pseudomonas infection there. This bacteria also produces this pigment as it's even growing in the lab. So if you were growing Pseudomonas aeruginosa in the lab, either on a plate or in a tube, the culture will appear green. Okay. Now, this bacteria can also cause some other diseases, something called Pseudomonas dermatitis, which is most often contracted from dirty swimming pools, and otitis externa. Otitis externa is an infection in the external auditory canal. And it's one of these diseases that's often referred to as swimmer's ear. So now, I'm not saying that every time a person gets swimmer's ear, that's always caused by Pseudomonas. There are other causes of swimmer's ear, like Staph aureus and stuff can also cause this, but this can be one of them, again, from swimming pools. But Pseudomonas dermatitis, again, most often contracted from dirty swimming pools. If the chlorine levels in a swimming pool have not been adjusted properly, then Pseudomonas can thrive in the swimming pool. And if a person that's swimming in this pool, if they have some like open cuts or sores on the skin, the bacteria can invade. And you can kind of see there's a slight sort of green appearance to the skin here. One other thing that the Pseudomonas bacteria does is that it fluoresces under UV light. So not only is there a green pigment, but if you were to hold a UV light over the bacteria, it would fluoresce. And you can see this person here with this burn, a UV light is being held over the burn, and this area that has this sort of whitish bluish color are areas that are infected with the bacteria. Okay, now, cat scratch disease. Now, this is caused by a bacteria that is not on your bacteria list, called Bartonella hensleyi. It's a gram-negative rod-shaped bacterium, and it's usually transmitted from being bitten or scratched by a cat. Which brings the question, well, how does the cat get it? Because cats are not just naturally, they don't have it on them. So what can happen is that if the cat has fleas on them, if they're contaminated with fleas, then the fleas, as they're kind of flying and buzzing around the cats and doing whatever they do on the cat, they eventually leave fecal droppings. And whenever the fleas leave fecal droppings, they also release the bacteria in their feces. And so they can kind of leave a lot of this stuff on the the cat's mouth or the cat's paws. And so when the cat scratches a person or bites them, it could transmit the bacteria from them to the human. Thankfully, I mean, it's not a very common disease. It's fairly rare. We only see about 22,000 cases of it per year, and it's rarely life-threatening. People that do get it at the site where the cat bit or scratched them, they might have these lesions called papules on their skin like that, or some vesicles, and sometimes they get like a fever and swollen lymph nodes. And very rarely does it really require any treatment. And severe cases, I mean, we're talking severe cases that have spread to the blood. Person might get ampicillin or erythromycin, but barring anything like that occurring, the person's immune system usually, fights this off pretty well. Anthrax, we're back to anthrax. So last time we talked about pulmonary anthrax. It's caused by the same bacteria, Bacillus anthracis. But here we're going to talk about cutaneous anthrax, which is the form in the skin. Now, even though pulmonary anthrax is the most deadly form of anthrax, it's not the most infectious form. In other words, if you were exposed to the endospores from anthrax, the most likely type of anthrax that you would get is the skin form, especially if you have wounds on the skin, if those endospores get into the wounds. It's a very, very infectious disease, more than the pulmonary one. And again, the endospores invade wounds in the skin, and then they start growing. And one of the primary symptoms is the formation of these nasty lesions on the skin that are called eschars. They appear black because there's a lot of necrotic tissue that's forming there, and it can spread, and it's very, very painful. And treatment of this is either with penicillin or erythromycin, but again, it's very rare. There is a vaccine for this, as we talked about before, but people that are vaccinated are either in the military because it's a bioterrorism hazard. It's also people that work with animals because the endospores tend to attach to the fur and the hide of animals. So, people that work with animals, they would get vaccinated too. Okay, now, as far as bacterial infections of the skin, there are a few more there. So you might see in your notes where it talks about Lyme disease and Rocky Mountain spotted fever. And those diseases, on the one hand, they can definitely be considered to be skin diseases, because if a person gets Lyme disease, they have a rash on their skin. And also, even with Rocky Mountain spotted fever, there's a rash on the palms of the hands. But Lyme disease and Rocky Mountain spotted fever are actually cardiovascular diseases. So for right now, looking towards your fourth test, just know what bacteria causes Lyme disease and Rocky Mountain spotted fever. We'll come back to these two diseases because we're going to come back to them when we talk about cardiovascular diseases, because that's really where they fit, okay? So let's kind of move on now to talking about viral infections of the skin. And what we're going to talk mostly about are German measles, regular measles. We'll also talk a little bit more about chickenpox and smallpox. As far as the papillomavirus, which causes warts, we're not going to talk about that today because papillomavirus really is more of an STD. So we'll talk more about that when we get into the sexually transmitted diseases section. But let's first talk here about German measles. So German measles is caused by the rubella virus, okay? Now, you do not need to know that it's an RNA virus. I'm going to scratch that out, but it's caused by the rubella virus, okay? And the way that it's primarily transmitted is through the respiratory route. So when a person has has rubella, they release the virus in their saliva and mucus. It's transmitted through droplets. So, and it starts off like a upper respiratory tract infection. Initially, a lot of the symptoms might resemble the common cold or the flu. But then what happens is that the virus, it migrates from the upper respiratory tract, mainly in the nasopharynx, into the blood, and then the blood can carry it to the skin where it causes a rash. It can carry it to joints where it causes a lot of joint pain, and it can also carry it to a lot of other organs, okay? But it starts off as a respiratory tract infection. Yeah, so a couple of other things about German measles caused by rubella. We don't see many cases of this anymore because of the MMR vaccine. Okay, the MMR vaccine, that stands for mumps, measles, rubella, and it's the last R here that protects against the rubella virus here. So the rash that typically occurs with German measles or rubella looks like what you see in the picture. It's more of a flat rash that we would call a macule. The other thing that you have to worry about is if a pregnant woman was never vaccinated against rubella and they contracted rubella during pregnancy, it is possible for the virus to cross the placenta and cause an infection in the fetus. Rubella is one of the organisms that are teratogenic. Remember, we talked about the, let me see here, the torch group of organisms that can cause birth defects. TO, that's the protozoan toxoplasma. R is what we're talking about right now, rubella. C is the cytomegalovirus, virus, and H is the herpes virus. And so here with rubella, okay, if a pregnant woman is infected with this, the virus can cross the placenta and cause a variety of different effects, from hearing loss in the infant, heart problems, blindness, and this causes this condition called congenital rubella syndrome. So to prevent any of this from happening, vaccination is important. And you can see here that when the MMR vaccine was first licensed for use back, I guess, around the early 1970s, before that, I mean, rubella was pretty prevalent, but once it was licensed, once the vaccine was licensed, the incidence rate for rubella dropped like a rock, okay, over the years. But one thing that has been occurring since the early 2000s, there has been this trend. It's not a big trend, but this slight trend in an increase in the cases of rubella. And the primary thing that's being attributed to is, for some reason, people not wanting to vaccinate their children for whatever reason, But again, you can see that vaccination is important. Now, let's talk about regular measles, not German measles, but regular measles. And just regular measles is caused by a slightly different virus that's called the rubeola virus. Okay, the rubeola virus. So not rubella, but rubeola. Got a bit of a different genetic thing here. But even though it's still called measles and it's called rubeola instead of rubella, it still spread the same way. It spread through respiratory droplets. And then it spreads from the upper respiratory tract into the blood, and then the blood can carry it to, the skin and cause a rash. So one of the primary signs of regular measles caused by rubeola is a widespread rash on the skin. But there's one thing that sets this type of measles separate apart from German measles. And what that thing is about a few days, I would say about a day or two before the rash on the skin appears, if you look in the side of the mouth and you look in the back of the throat, what you would see are what are called Koplik spots. And Koplik spots are a telltale sign that the person is infected with measles, and eventually they're going to get the rash on the skin. Okay. And I'll show you what the Koplik spots look like. But if a doctor sees a child with those Koplik spots in the back of their throat, it means that they're going to get the measles. They're already infected. Some other complications that can occur, and this is again why vaccination is so important. If somebody hasn't been vaccinated against the rubeola virus, and they get infected, in some cases it can spread to the brain and cause a very severe form of encephalitis, which is a really bad brain infection. The type of encephalitis that it's referred to is as SSPE. This is kind of a mouthful. You can just remember SSPE for short, but SSPE stands for subsclerosing panencephalitis. Okay, so subsclerosing panencephalitis. It's just a very, very severe brain infection caused by this. So again, the best thing to do to prevent this is vaccinate. The rash on the skin looks like this, but like I said, about 2 to 3 days before the rash on the skin appears, if you suspect this and you look in the back of the throat, you will see Koplik spots. So Koplik spots are these little areas right there that you see there, those are areas that represent where the virus is starting to gain access to the body. And again, just to prove how vaccines are effective, you can see here the drop in measles infections after the vaccine was licensed for use. Chickenpox. So we've kind of talked about chickenpox before. Chickenpox is caused by the herpes varicella zoster virus. So the virus that causes chickenpox is actually in the herpes family of viruses, which includes the oral herpes virus and the genital herpes virus. I'm not saying they're the same viruses, they're in that same family of viruses. And this virus is also, just like with the both forms of measles that we just talked about, it is spread through respiratory secretion. So when a person that has chickenpox, they usually release the virus in their saliva and their mucus secretions. Okay, and it can spread from the respiratory tract into the blood, and the blood will carry to the skin. And when it gets to the skin, a person will start having these itchy lesions on the skin. Now, those itchy lesions on the skin, I mean, the worst thing that they can do is maybe, itch like crazy, and, potentially cause some scarring in the skin. But it's really important that when a person has these lesions and they're itching, they shouldn't scratch it. I mean, they should try to avoid as much as possible from scratching those lesions, because these lesions that you see here, these are open wounds. And just like any other open wound in the skin, they are susceptible to being infected by other bacteria. So if a person starts scratching at those, wounds, they could introduce bacteria that's on their fingertips into the wound and cause secondary infections. Okay, secondary bacterial infections in the skin. Now, many of you out there may have had chickenpox, but we don't really see it a lot anymore because most kids at a very, very early age are vaccinated against it. Okay. In fact, you can't even send a child to school once they start getting into school. You can't even send them to school without this vaccine, right? Now, a couple other sort of complications that can occur with chickenpox. So there's one complication, kind of an interesting one that I want to talk about. It's called Reye syndrome. Reye syndrome has been associated with a person that has chickenpox, and to alleviate some of their symptoms, if they take aspirin, which you should never do. If you have any viral infection, not just this one, but if you have any viral infection and to alleviate your fever or pain or discomfort, if you take aspirin, then there is a risk for developing this Reye syndrome where the brain becomes greatly inflamed and can cause a lot of brain damage. And this used to be more prevalent in children, where if a child got chickenpox, the parents might have given aspirin to lower their fever or whatever. And they don't know why this is happening. They have no idea what the association between aspirin and a viral infection like this is, but we do know it happens. But it causes a lot of this brain inflammation, which can cause brain damage and persistent vomiting and even death. So again, we don't see this as much as we used to, but just a word of warning: if you're infected with any virus, not just this one, okay, but any virus, even like the flu virus or some other virus, you really shouldn't take aspirin. Take ibuprofen or Tylenol, but avoid taking aspirin, because although the risk is small, there is a risk of this developing. Now, we also talked about before that if you've ever had chickenpox, so if any of you out there have had chickenpox, you are at risk for later on developing shingles, because this virus is a latent virus. It never leaves your body, but it remains dormant in your peripheral nerves. So that later on in life, if you are subjected to some sort of, I don't know, emotional stress or physical stress, the virus will reactivate and cause these very painful lesions that you see here, following along the path of a nerve. And this is why most people that are susceptible to shingles, they're usually like over 55 or 60. Although I've heard of people getting the shingles in their 20s, and it's not unheard of, but it's more likely to get it as you get older. And that's why, once a person gets to like 55, 60, it's recommended that they get the shingles vaccine to prevent this from happening in them. All right, smallpox. Now, even though we're talking about smallpox here, the thing is that smallpox has been eradicated. We don't see smallpox anywhere. The last known case of smallpox was in 1977, somewhere in Somalia. And the reason that it's been eradicated is because from the beginning of last century all the way through the 1970s, mass vaccination was done against it. Now, I think a lot of other countries still do vaccinate against smallpox, but we ended the vaccine in the United States back in the 1970s because we don't see it anymore. But smallpox, it had to be vaccinated against because it can spread very quickly and infect a lot of people and cause death. Or if a person doesn't die from it, they can be left with very intense scarring on their skin. So the virus, the smallpox virus, is primarily transmitted through the respiratory route. Now, when I say respiratory route, yes, it can be transmitted through saliva and mucus, but when a person's having a smallpox outbreak on their skin, they start having these vesicles, which then turn into pustules. And eventually those pustules, they dry up and are on these little flakes of skin. And those little flakes of skin, they can flake off the skin. But the thing is that it's not just a flake of skin, it's the flakes of skin can contain the virus. And if a healthy individual is there, they can inhale the little flakes of skin containing the virus and they can get it. Okay. And again, it can cause some upper respiratory tract infections first, but the lesions on the skin is really where the problem is. Eventually, at first it kind of starts off as like macules, like a flat rash, and then it kind of develops into papules and vesicles and pustules. And it can cause a lot of death, but if a person doesn't die from this, they're usually left with really intense scarring on the skin. Herpes skin infections, well, really the only one that I want to talk about right now is HSV-1. Remember that HSV-1 is the virus that primarily causes oral herpes, and which is also the cold sore. So if you suffer from cold sores, you were probably infected when you were a little kid by coming into contact with saliva from another infected individual. And what happens is that virus, it remains dormant in your trigeminal nerve, which is the nerve that innervates a lot of the muscles and the skin in your face. And then later on in life, when you're an adult, due to emotional stress or physical stress, it can reactivate and cause a cold sore or oral herpes. And so it typically, causes an outbreak, once or twice or three times a year. All right. Now, there is a possibility for a complication that can occur. And what that complication can be is what's called herpes encephalitis. This is where, given the close proximity of the virus to the brain, if a person becomes very elderly, or this can also happen in newborns, if mom's infected with the virus can enter the oral cavity of an infant during birth, and the virus can travel up the trigeminal nerve, into the brain and cause herpes encephalitis there, or, the immunocompromised. It's rare, but it can happen, but it is a possible complication. Okay, so with fungal infections of the skin, let's talk about a few of these. A lot of fungal infections of the skin are very superficial. They're just on the surface of the skin. And some of the ones that we're more familiar with are like tinea pedis, which is athlete's foot, tinea crurus, which is jock itch or infection in the groin area, tinea unguium, which is a nail infection, and then tinea corporis, which is often referred to as ringworm. And so they are all fungal infections, superficial fungal infections on the skin. The primary difference between them is the location. So it's either going to be in the foot or the body somewhere, or the groin area under a nail. But that's pretty much it. And even though we give these diseases different names, they're pretty much caused by the same fungus. There's this fungus here that's called Trichophyton rubrum that you see here is one of the more common causes of each one of these. Okay. And, Tinea corporis, which I said is ringworm, and Tinea pedis, which is athlete's foot, these are typically treated with topical antifungal creams like clotrimazole, miconazole, ketoconazole. Candidiasis is caused by Candida albicans. Does anybody remember what type of fungus Candida albicans is? It's a yeast. It's not a mold, it's a yeast. Okay. And one of the things that it can cause is an oral thrush. We see an oral thrush mainly in children, especially if the child has taken a lot of antibiotics and those antibiotics have wiped out the normal flora in the mouth. Well, that can serve as an opportunity for this yeast to move in and cause an infection here. And combined with that, to make matters worse, if that child is also really used to drinking a lot of high sugary things, this yeast loves sugar. And so the more sugar you give it, the happier it is. Candida albicans is the primary cause of DAPE rash in infants as well, because we all carry a little bit of Candida albicans in our large intestine. And so, in feces, it's usually released. And so if a baby's diaper hasn't been changed in a while, the yeast can actually infect the skin and cause an inflammation. And it can be very painful depending on the severity. But luckily, it's usually easily treated with topical antifungal creams. Okay. Now, the last two diseases that I want to talk about here are described as being wound infections. And they're described as being wound infections because they usually infect a very deep wound in the body. Something that's caused by a sharp object that penetrates the skin fairly deep. So it's not like a surface cut, but it's a really deep wound infection. And the object that penetrates the skin deeply like that contains the endospores from the bacteria. So the first of these diseases is called gas gangrene. And gas gangrene is caused by Clostridium perfringens. Now, the first thing that should come to mind whenever you see the genus name Clostridium is that we know that it's an endospore form. But the second thing is that Clostridium, all species of Clostridium are obligate anaerobes. So when this sharp object punctures the skin really deeply, it has to create an anaerobic environment for itself. So it can't grow just on the surface of the skin. It's got to go really deep in the skin. And as it gets deeper in the skin, it creates a little anaerobic environment itself, hiding itself from the oxygen, and starts to flourish in there. And as the bacteria grows, the bacteria produces a lot of toxins that can destroy a lot of the connective tissue in the skin, resulting in a lot of gangrene and just dead tissue. A lot of times, the only treatment for something like this would be to amputate the parts of the body that are infected. The other thing is that as the bacteria is growing in the skin, it produces gas bubbles. So it's kind of hard to demonstrate this, but if a person had this in their arm or their leg, and you move the arm or the leg, the gas bubbles in the dermis start to pop, and you'll hear this like pop, 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 pop sound. Okay. The other thing is that another way to tell if a person has gas gangrene is if you smell it. This bacteria is one of the worst smelling bacteria. So if it's in the skin, that area of the skin that's infected will smell really, really bad. As far as treatments are concerned, there are antibiotics that you can use to treat it, but you have to also do other things in conjunction with that. One thing that's done in really severe cases is, along with antibiotics, the patient that's infected with this will undergo what's called hyperbaric oxygen therapy. what they do is they place the patient into a oxygen chamber. Now that makes sense, hopefully, because this is an obligate anaerobe. It hates oxygen. So if we expose it to a lot of oxygen, the thought is, along with antibiotics, it will die. If there's a lot of this necrotic tissue that's occurring, you have to get rid of that dead and dying tissue. Well, you could go in there with little tweezers and do it yourself, or you could use sterile maggots. So there are a lot of hospitals and clinics that actually raise sterile maggots. So these are maggots that are free of bacteria. And what they'll do is they'll put the little maggots on there, and the maggots eat away the dead and dying tissue. So the maggots do all the work there. All right, now, yes, it's kind of gross, but it works. The other wound infection that we're going to start talking about today, but we're going to come back to on Wednesday, is tetanus. So tetanus definitely is a wound infection, because the only way that you can get infected with it is by being punctured by a sharp object containing the endospores from the bacteria. And the bacteria is Clostridium tetani. But the effect of the infection is really on the nervous system. So the endospores from Clostridium tetani, they enter the body through a deep puncture wound. They create an anaerobic environment for themselves. They start growing, and they start releasing this toxin called the tetanospasmin toxin. And the tetanospasmin toxin causes muscles on both sides of the body to contract. Now, kind of going back to your anatomy physiology, muscle physiology days, remember that if you contract a muscle on one side of the body, the muscles on the opposite side of the body should relax. So let's say that I contract my biceps muscle. So I want to flex my elbow and contract my biceps muscle. Well, if my biceps muscle is contracting, on the other side of the arm, the triceps muscle should relax. Well, what this tetanospasmin toxin does is that it causes both muscles to contract at the same time. All right, and so we'll come. So it really has this effect on the nervous system. So we're going to come back to this. Now, the best prevention from tetanus is to get your tetanus vaccine. Okay, it's a tetanus shot, and the tetanus shot is a toxoid, because what they're vaccinating against you is not the bacteria but the toxin. And you're supposed to get a tetanus shot about every 10 years or so to boost your immunity. And let's say that it's been a while since if you hadn't had your tetanus shot and you got infected with the bacteria. As part of the treatment, in addition to getting antibiotics to kill the bacteria, you also have to get an antitoxin. And the antitoxin are antibodies against the toxin. All right, so you have to do that too. Okay, so that finishes up this section on skin diseases. We'll stop today. We're not going to get into anything new. And on Wednesday, we will pick up with talking about nervous system diseases. Does anybody have any questions before we end today's session? So C5 peptidase, it destroys the C5 component of complement. The normal function for C5 is to attract white blood cells to an area that's infected. So if a bacteria produces that enzyme, it destroys that complement protein, and you can't move in. You have a much harder time of attracting white blood cells to an area of infection, and the infection spreads. Does that help? Anybody else? Okay, well, if there are no more questions, I will talk to you on Wednesday, and see you then. All right, take care.